to the Therapeutics Chronicles. I'm your host, Momin Wali, and I'm so glad you have joined me for another episode where we break down medications, uncover practical insights, and share clinical pearls to empower your practice. Whether you are a healthcare student, a new professional, or a seasoned practitioner brushing up on your knowledge, this podcast is designed for you. Today, we are diving into a medication that's become a staple in the management of ADHD, Lisdexamfetamine, brand name Vyvanse. Let's break it down together. And as always, do not forget to subscribe, share this episode, and send your feedback to theterapeuticschronicles@gmail.com. Let's get started. Lisdexamfetamine is a long-acting prodrug of dextroamphetamine, making it unique among ADHD medications. It's primarily indicated for attention deficit hyperactivity disorder (ADHD) in patients aged 6 years and older, and it is also approved for binge-eating disorder in adults. The mechanism of action is rooted in its ability to increase the availability of norepinephrine and dopamine in the synaptic cleft. By doing so, it enhances focus, improves impulse control, and modulates behavior. Key challenges in ADHD management. The prodrug design is what sets lisdexamfetamine apart. Unlike immediate-release stimulants, lisdexamfetamine requires enzymatic activation in the body, providing a smoother and more sustained effect throughout the day while reducing the potential for misuse. Pharmacokinetically, lisdexamfetamine is absorbed quickly after oral administration and converted to its active form, dextroamphetamine, primarily in the blood. The onset of action is typically within 1 to 2 hours, and its effect can last up to 13 hours. This extended duration makes it a convenient once-daily option for patients, especially school-aged children or working adults who need consistent symptom control throughout the day. The medication is eliminated primarily via the kidneys, with minimal hepatic metabolism, which reduces the risk of significant drug interactions. Now, let's talk about dosing. Lisdexamfetamine is available in various strengths, ranging from 10 mg to 70 mg capsules. The typical starting dose for ADHD is 30 mg once daily in the morning, with dose adjustments made weekly in increments of 10 mg or 20 mg based on response and tolerability. The maximum recommended dose is 70 mg per day. It is essential to emphasize that lisdexamfetamine should be taken in the morning to minimize the risk of insomnia. For binge-eating disorder, the initial dose is the same, usually starting at 30 mg daily and titrated up to a maximum of 70 mg as needed. Always assess patients' individual needs and tolerability during titration to find the optimal dose. What about side effects? Like other stimulant medications, lisdexamfetamine has a predictable adverse effect profile. Common side effects include decreased appetite, insomnia, dry mouth, irritability, and weight loss. Gastrointestinal issues like nausea or abdominal discomfort are also reported. In children, growth suppression is a concern, making regular monitoring of height and weight crucial during long-term therapy. Rare but serious adverse effects include cardiovascular issues like increased heart rate or blood pressure, as well as psychiatric symptoms such as mood swings or exacerbation of anxiety. That's why a thorough patient history, including family history of cardiovascular or psychiatric conditions, is essential before initiating therapy. Let's shift to drug interactions. Since lisdexamfetamine's active form, dextroamphetamine, affects the central nervous system, it can interact with medications that influence the same pathways. For example, co-administration with monoamine oxidase inhibitors is contraindicated due to the risk of hypertensive crisis. Other stimulants or substances that increase the catecholamine levels should be avoided or used cautiously, as they can amplify cardiovascular and CNS effects. Acidifying agents like ascorbic acid can reduce the efficacy of lisdexamfetamine, while alkalinizing agents such as sodium bicarbonate may increase its effects. It's important to counsel patients on potential interactions with over-the-counter medications or supplements, especially those that may influence pH levels or CNS activity. Now, let's get practical and discuss some common mistakes in prescribing and using lisdexamfetamine. One frequent issue is prescribing it for patients without thoroughly evaluating for contraindications, such as a history of substance misuse or untreated anxiety disorders. Because lisdexamfetamine has a lower potential for misuse compared to immediate release stimulants, it is often considered a safer option. However, misuse can still occur, particularly in high-risk populations, so it is essential to assess patients' histories carefully. Another common pitfall is inadequate monitoring. Patients on lisdexamfetamine should have regular follow-ups to monitor blood pressure, heart rate, growth in children, and overall response to therapy. Let's walk through a few case scenarios. Case 1. A 10-year-old boy is diagnosed with ADHD and prescribed lisdexamfetamine 30 mg daily. At his first follow-up, his parents report that he is having difficulty sleeping and has a reduced appetite. What's the plan? First, confirm he's taking the medication early in the morning. If the timing is not the issue, consider a lower dose or implementing strategies like a protein-rich evening snack to support appetite. Case 2. A 35-year-old woman with binge-eating disorder starting lisdexamfetamine at 30 mg daily. At her second visit, she reports significant improvement in her symptoms but also notes occasional palpitations. In this case, evaluate her heart rate and blood pressure. If these are elevated, reducing the dose or switching to a non-stimulant option may be appropriate. Case 3. A 16-year-old high school student with a history of anxiety is prescribed lisdexamfetamine for ADHD. After 2 weeks, he reports feeling jittery and more anxious. This scenario highlights the importance of addressing coexisting conditions before initiating therapy. For this patient, reducing the dose or considering a non-stimulant ADHD medication might be better options. Before we wrap up, let's discuss the broader impact of lisdexamfetamine on patients' lives. Beyond its clinical effects, the medication can significantly improve quality of life for patients with ADHD or binge-eating disorder. For children and adolescents with ADHD, improved focus and behavior can enhance academic performance and social interactions. For adults, better symptom control often leads to improved productivity and emotional well-being. However, these benefits are best achieved when lisdexamfetamine is part of a comprehensive treatment plan that includes behavioral therapy, lifestyle modifications, and regular follow-up. Here are some clinical bars to take away. First, always individualize treatment. While 30 mg may be the starting dose, not all patients will require titration to higher doses. Second, educate patients and caregivers about common side effects and how to manage them, such as scheduling meals and snacks to combat appetite suppression. Third, remember that non-stimulant options like atomoxetine or guanfacine are available for patients who do not tolerate or respond to lisdexamfetamine. Lastly, emphasize the importance of adherence. Missing doses or inconsistent use can result in a return of symptoms and reduced efficacy. Alright, rapid fire Q&A time. What is the mechanism of action of lisdexamfetamine? It is a prodrug of dextroamphetamine that increases norepinephrine and dopamine availability in the brain. How long does its effect last? Up to 13 hours. What is a key contraindication? Use with monoamine oxidase inhibitors. What is the most common side effect? Decreased appetite. And that's a wrap up for this episode of the Therapeutics Chronicles. I hope this deep dive into lisdexamfetamine has provided you with practical insights and actionable knowledge. Do not forget to subscribe, share this episode with your colleagues, and send your feedback to the Therapeutics Chronicles at gmail.com. You can also connect with me personally on LinkedIn at Mominwari. Until next time, stay curious, keep learning, and let's continue making a difference in patient care. Take care.